This video continues Chapter 26 of OEC 6. We're going to look at the anatomy of heat-related emergencies and then define 4 types of heat-related emergencies. So we're really going to focus on these first 3 objectives. We'll talk about the acclimatization to a hot environment as well when we talk about the anatomy. So some key things that you'll see are core body temperature, heat acclimatization. We'll talk about the heat index as well, and hyperthermia and thermoregulation. So anatomically, our normal core body temperature is 98.6 degrees Fahrenheit. Thermoregulation is the process of maintaining normal body temperature, and that should work even if the surrounding environment, the ambient temperature, is very different than our own core temperature. Now, if our regulatory systems are no longer able to cool the body, a heat-related illness can occur. We have to be especially mindful if we're in a hot environment and engaging in some sort of physical activity. Now, one of our key mechanisms for thermoregulation is, of course, sweating. You have to be adequately hydrated before sweating occurs, and that's because sweat on the skin will evaporate and carry heat away. Evaporation is one of our 4 mechanisms for heat exchange. Now, this really also depends on not just the ambient temperature, but the ambient humidity. If there's a lot of water vapor in the surrounding air, then the ability for sweat to leave our skin into the surrounding atmosphere is minimized. Additionally, we can have vasodilation. If we expand the blood vessels in the peripheral system, that's just going to allow for another mechanism, radiation, to dispense heat directly to the environment. Now, where the ambient temperature exceeds body temperature, loss of body heat by radiation is not effective. If the outside air is hotter than the heat that's trying to leave our skin, it becomes pretty tough. It's not effective, and so sweating becomes much more important. Keep in mind, losing heat through 4 mechanisms, same as for a cold injury. Conduction is contact, convection is by wind or moving fluid, evaporation, and radiation as well. So one of the considerations is the heat index. This is like the hot equivalent of wind chill. Whereas wind chill was ambient temperature and wind speed, this is ambient temperature and humidity because it directly affects those mechanisms for getting rid of heat. Now, in any case, preventing heat injuries comes down to, in large part, how adequately hydrated you are, because this allows you to maintain sweating as that primary mechanism. During exercise in hot environments, you can lose up to a liter of sweat each hour. So maintain adequate hydration and match your hydration to your level of activity and the ambient temperature. Adequate preparation is required to maintain that thermoregulation. So heat acclimatization is your ability to adapt to a hot environment over a period of time. And so if you are able to take trips to that hot environment or minimize your exposure to about 1 hour over the course of several days, you'll start to acclimatize. If this is not possible before a trip, then limit what you're doing during the hottest part of the days until your acclimatization has occurred. During periods of exercise lasting several hours or more, we need to maintain adequate water intake and perhaps some salty snacks as well. That'll help maintain hydration. Remember, you're in charge of your own hydration. If you see light-colored urine, then you're probably adequately hydrated. Be careful, don't let that progress to being darker yellow. That will indicate you're on your way to dehydration. So we've got sweating and we've got blood vessel dilation for radiation. You can control this further in terms of preventing heat illness by just proper behaviors. Make sure that you're wearing lightweight, light-colored clothing that reflect the sun, a broad-brimmed hat, perhaps act and engage in activities during the morning or the evening when it's not as hot as the high part of the sun during the day. So some common heat-related injuries really just kind of relate to this idea, hyperthermia. Hyper meaning above and thermia, the temperature. And that's that broad spectrum of all of these injuries. Now, our normal core temperature was 98.6. We're talking about something that's over 101 degrees Fahrenheit. Extreme or untreated hyperthermia can really become life-threatening, and especially in pediatric and geriatric patients or patients with poor fitness. If they have a chronic medical condition, that can also increase the possibility of heat illness. When the body's mechanisms for transferring heat to the environment, such as through evaporation and radiation, are overwhelmed and the body can't tolerate the excess of heat, that's when a heat injury is going to occur. And it's going to be progressive. We might see heat-related syncope progressing to cramps, progressing to heat exhaustion, or heat stroke. Heat-related syncope and heat cramps usually precede the other more serious conditions. So what is heat syncope? It's basically fainting due to the heat. So if the body is heat stressed and we're shunting blood to the peripheral vessels and vasodilation in an effort to radiate heat from the body's surface, what if that blood doesn't return from the surface rapidly enough? What if we end up being slightly hypotensive as well? Well, that's going to decrease the brain perfusion and result in some fainting. Might be preceded by some feelings of nausea or lightheadedness, but it also may occur entirely without warning. Heat cramps occur in the large muscle groups after exercise in a hot environment, and they're tied to that poor preparation of dehydration or an electrolyte imbalance. They can be pretty painful. Stretching and rehydration and perhaps electrolyte replacement will prevent them from recurring. Now, the progression to heat exhaustion is going to look like this. The patient is going to be exhausted, possibly some nausea, some leg cramps, but we're going to have notable excessive sweating, a core body temperature that's greater than 101, but they still have a normal level of responsiveness. When the body loses too much water and too many electrolytes, we get that dehydration, and as a result of that dehydration, we get some hypovolemia, and that's where many of the signs and symptoms of heat exhaustion occur. The body's going to respond to the treatment, and any change in mental status does not persist. Heat stroke is a life-threatening emergency, and we'll characterize it by really that altered mental status and decreased level of responsiveness. The core temperature is going to be greater than 104 degrees, and like some other medical conditions we've encountered, we're going to see tachycardia and a high respiratory rate, and eventually the patient will become severely hypotensive. The defining characteristic between heat stroke and heat exhaustion is the altered mental status. We need to get that patient out of there and evacuate them. Heat stroke is the most serious heat illness and can occur from either exposure, without exertion, classical heat stroke, or exertion in a hot environment, exertional heat stroke. The normal mechanisms for shedding excess heat just get overwhelmed. Now, if untreated, it can cause damage to the brain, the heart, and the blood vessels, additionally, the liver and the kidneys. And if that shock is left untreated, heat stroke can result in death. So to summarize, here are heat emergencies, kind of progressing from heat cramps to heat exhaustion to heat stroke. In any case, we initially are going to kind of result from some dehydration that will then progress to the failure of some of these heat regulating mechanisms. We get a progression in terms of level of responsiveness to a changed level of responsiveness or altered mental status in heat stroke. Our core temperature is going to progress from our standard 98.6 to as high as greater than 104 in heat stroke. And then our sweating mechanisms may still be intact through heat exhaustion, but they've started to fail by the time we get to heat stroke, and the patient's skin will be hot, red, and dry. We see this progression, pay attention, and be especially mindful of prevention.